Bernard, Tyson, good to have you. Thank you very much. This is the Industrialist Dilemma, where we're talking about both new startups and disruptive companies that are changing industries, as well as how some of the largest incumbents in those industries are responding to digital transformation. And we wanted you here today to talk about what Kaiser's doing to really kind of transform healthcare in this digital era. So maybe just as a kind of kicking it off and starting off, I don't know if you want to describe the state from your perspective of kind of healthcare today in 2016. Like what is the environment like? What are the big problems, and how do you see Kaiser fitting into that, with or without the digital angle?
I guess I would start with is in the midst of the most massive amount of change that I've seen in my career in healthcare, and for sure in Kaiser Permanente. And it has really taken off over the last, I would say, 8 years. And it's a thing called the Affordable Care Act. The Affordable Care Act did two things. One, it provided access to millions of Americans to get into the front door of the American healthcare system. And number two, it put a couple of $100 billion of new money into the healthcare arena. And everyone has been going after that. And it's all based on a theory that the American healthcare system is broken, and what we need to bring into the industry is new ideas, new talent, new innovation, new technology, and disrupt an old system that was fundamentally designed to do a couple of things. One, to intervene when a person got sick. So it was a fix-me system. It was designed to pay for volume, so it encouraged doing more of something. And it was designed in a very fragmented way. So if you look at the history of healthcare in America, people used to die young, so there was no real need for healthcare. You just died.
Yeah, and then we ostensibly solved that part.
And then a couple of things happened. One, we learned how to deal with waste and sanitation. And number two, we learned how to process foods. So people started to live longer. And as people started to live longer, stuff started to happen to the body. And the healthcare system was a fix-me system. It was something happened, let's fix it. And that's how the industry grew up. So what we have today is a healthcare system in which someone is birthed and born, and then someone dies, right? The healthcare system is financed towards the last year and a half of a person's life. So about 75% of the healthcare dollars are actually spent on about 20% of the population. And of that 75% that is spent on the 20% of the population, about 90% of that 75% is actually spent in the last 12 to 18 months of a person's life. So you have an entire healthcare system that is financed towards the end state of a person's life. So the question that I get to work on, and what I'm trying to do in transforming the industry, is based on the fundamentals of what Kaiser Permanente is about, which is prevention. Which is to say, the best cure is to prevent or catch something early, and therefore you can treat it in a more efficient way, effective way, and prolong the what we call the healthy life years of an individual. So the question is, what kind of model do we want to build in the 21st century? Do we want to continue with a sick care model, and do we want that model to be an intervention model, which would lead to what we have today, that when you need to be in the hospital, that's an intervention in the hospital? Do you want a wellness model that begins to incent and engage in this case, the American people in a different narrative, which is a big part of what's going on is your responsibility. It's called what you eat, what you drink, how you treat your body, how you exercise or the lack thereof. And then there are other things that are just happening to the body that comes with aging and or genetics and hereditary illnesses, right? So I would offer to you, inside of that context, to figure out how to redesign the healthcare industry in which the dollars that are expended here are being repurposed through the lifetime of a person's life, with the objective of living longer and living more healthy life years.
And what is it about Kaiser's either business model or structure that lets you guys sort of take advantage of this strategy that is different from other kind of hospitals and healthcare providers?
Well, actually, many of your students touched on it and spoke to it. By the way, you have a smart class. I mean, God. I mean that. My wife went to Stanford. I couldn't go to Stanford. My wife went to Stanford. Smart.
They got that one wrong then.
Yeah. Smart. Yeah. And it came up in this discussion. One is our incentives are aligned. And I'll touch on that in a second. The second one is we have the end-to-end process. So when the Kaiser Permanente system is, to use this analogy, when you give me the dollar, I'm responsible for everything. And so I get to take the dollar and with my doctors, look at the best distribution of that dollar along the whole healthcare continuum. And so our physicians are not incented or disincented in a different way if a patient needs to be in a hospital or in a nursing home or in the medical office building, or you pick the spot, because we own the entire healthcare dollar. In the hospital industry, you only own a piece of that dollar. And your revenue is given when you have what we call a head in the bed. So in my system, a hospital is an expense center for me. It's not a revenue center. I already have the dollar. And so I can build a system of care, and the reason why our hospital days are more effective than almost anyone in the industry is because when you're done in the hospital, I have a warm handoff to the outpatient. In the rest of the industry, when you're done with the hospital, you're done with the hospital. The third piece is that the alignment of the physician and the other medical professions to the health plan is tight. And what I mean by that is in the industry, most of the provider side feels like they are in war with the, quote, insurance side. In my business model, I do the coverage and the care. And so my doctors sit at the table with me and we talk about the 10.5 million members that we now are honored to take care of and what's the infrastructure that we need to continue to build to do that. So you get to the question that I think about all the time. If I was redesigning, if I was rebuilding Kaiser Permanente today, versus how my forefathers did it, God bless them, I wouldn't start with a hospital. The beginning of Kaiser Permanente was a hospital that then eventually grew into an integrated system. If I was building Kaiser Permanente today, I would start with technology. I would start with my technology platform, and then everything else will follow that. Why would I do that? Because the entire healthcare system is also built around everybody coming to it. That's the way it was designed. And what we are proving at Kaiser Permanente is that you can distribute care out. So someone mentioned, for example, the use of the mobile phone. Last year, we did almost 30 million secure e-visits. That's between the member and the physician. I'm now putting $300 and something million into building an entire digital platform. Why? Because telehealth is also going to be our future. Where with high definition, you pick it, iPad, iPhone, TV, you pick it. We'll be able to create visits between our members and the physician that is not only more efficient all the way around, because the member does not have to drive across town, park, talk to a receptionist, take off their clothes, wait in a room, read an old magazine, although we have new magazines.
Good, yeah.
Until we get there.
The latest week.
Right?
Yeah.
And do all of that. It's a direct relationship between the physician and between the members. In our almost 30 million e-visits on last year, on a scale of 1 to 10, the ratings of that is something like 9.3, 9.4. So the level of satisfaction is extremely high. It's possible, though, because the physician has the relationship with the member. And so, one, the relationship is there, and two, every one of my 10.5 million members has a longitudinal electronic health record. And my requirements of the organization of IT is that the systems must be up 99.99999% of the time. And so the information must always be readily available in the hands of the physicians and the authorized users when that interaction happens between the member and the system.
Okay, so I don't need to pitch you on digital, it seems. Okay, what are you seeing other, if you're not a fully integrated provider, are you just directly disincentivized from doing these things, or can you literally not do them because your relationship with the patient is entirely different, or like why can Kaiser do this and your average hospital, can't do it?
The digital piece?
Yeah.
No, a lot of healthcare organizations are trying to figure out how to get into the digital piece and what are the smart investments to make there. One of the challenges, though, is if you are running a hospital system, you are subject to whether or not the physician and the insurance company wants to use you from one year to the next. And so if you're running a hospital system and you have to continuously think about what's the level of assurance that I'll have this physician population admitting patients into my hospital over the next year, there's a level of uncertainty because many of the physicians in the community setting could have access to Aetna and United and the Blues at the same time. And so changing from one insurance company to the next is something that can happen very fast. In my system, the physicians are fully engaged, exclusive to me, and the relationship is such that it is long-term. Right. The second thing is our patients, our members, stay with us much longer than they do in the other healthcare systems. And so you do ask yourself the value proposition of the investments that you would make, and then whether or not you would have enough of a continuous population to provide that continuity for payback.
How do you determine where you need to invest in technology development versus where you want to partner with people on the outside?
That's a great question. It's a great question. It's a sea change inside of Kaiser Permanente because we have and we've had a lot of smart people in the technology part of our organization. I think I have something like almost 6,000 employees that work in IT. I'm a big-time technology believer. And what we were doing, though, is because we have such a complicated model, we had two major problems. We've always used technology in Kaiser Permanente. We have this thing called legacy systems, and they are very, very, very expensive. When the government had the problem when they first introduced the Affordable Care Act, and you remember the big issue was that the system wouldn't work. Healthcare.gov. As some of you, if not all of you know, the real issue behind it was a system put on top of legacy systems, and somebody forgot to look at it from end to end, is my version of this. Yep. And so they turned on the switch, and part of the light came on over here, but over here it didn't. And so what you ended up with was the lack of a seamless system now to do what needs to get done. We have the same identical issues in Kaiser Permanente. that we built Kaiser Permanente from its history with technology that grew with the organization. And so we've had legacy systems in place. And so when you bring the 21st century technology into my environment, and our systems have been built to match our model as much as possible, so everything is integrated. So when I put in a new pharmacy system that we completed last year, what was supposed to cost me like $500 million cost over $1 billion. And the $1 billion is because we had to plug it into all of our other systems, so we create the whole integrated approach for our members. Now, why can I invest that kind of money in there? It's because drugs are very expensive. And drugs is a part of our therapeutic medicine. And so for us, it's very important if we give you 30 days worth of diabetes medicine, and it's now 35 days and you haven't reordered your medicine, it's very important to us that we figure out what's not working in our relationship, that you are potentially not taking your medication. You go to the rest of the world, it's all about the distribution of the drug, and that's it. And so what we now are looking at is what are the right strategic partners across the board. And so we have relationship with Google and Apple and Microsoft and IBM. We are heavy now into cloud technology. How to decide what should be in the clouds and what must be in our data center. I mean, that's a sea change, because I used to have to look at buying data centers as much as I had to look at buying medical office buildings, because of the amount of data that we accumulate and that we store. So that's really been a sea change for us to partner with expert technology companies that can do it faster, more efficiently, and then the challenge becomes how to plug it in to an organization like Kaiser Permanente that still has a lot of legacy systems.
One thing that has been a theme of a lot of the kind of incumbents or sort of traditionally industrial companies is that they're held back by that baggage, they're held back by those legacy systems, and then they have disruptors come in and they're building in the cloud, by scratch, modern systems. How do you ensure that Kaiser isn't sort of either moving too slowly or held back by or anchored by maybe those legacy technologies? Have you given your technology group some sort of mandate of X amount has to be new in a refactored way, or like how do you ensure that the organization doesn't sort of grind to a halt because of those legacy systems?
Yeah, it's not just IT though. I would say that the secret in our situation, because the technology is so critical to everything that we do at Kaiser Permanente, everything that we do at Kaiser Permanente. So if you came into my environment, you will not see me with just the technology people at the table telling me how great it is. You would come into my office and you would see doctors, and you would see hospital administrators, and you would see the people who are actually doing the work. Because some companies decide that they want to use technology to absolutely disrupt the operations and to force change. That's not my strategy. I'm very clear in my organization. Technology is an enablement of the strategies of how we run and provide health care. And so my physicians sit down and look at and imagine how technology is going to help them to become more efficient and effective. We do have technology that will naturally disrupt, but the technology has evolved in Kaiser Permanente in part because we already have the integrated system.
Right.
And now we're looking at how to leverage that to the next level.
It seems like your physician base and the medical base in general, you'd imagine that there's probably resistance in other hospital environments because it is a sort of they're disincentivized from not having the patient come in and see them because of the billing structure and the financial model. But for you, the physician is essentially inherently interested or incented to make sure that the patient is as healthy as possible. Have you structured that?
Yeah.
Okay.
Yeah. But I don't want to, the challenges that we had, for example, when we went to electronic health record, we had many physicians who were fearful of the invasion of technology on their practice. And so if you have traditionally been a high-touch, hands-on physician, and now all of a sudden you're in a room with a patient, and you got to think as much about what I'm putting on the line as I am taking care of the patient, that's a generational gap of how to deal with that, right? Versus the newer, younger, who just grew up with the technology and it's a natural act. So we had those kind of cultural issues to deal with when we began to introduce, in particular, the technology into the exam room. Fast forward, I'm now building a set of new medical office buildings where the technology is right in front of the patient and the physician, and we're bringing in 21st century chairs that no longer you're going to have the little gurneys in the room. You sit down and we take your weight from the chair. You're going to be looking at a high definition screen in the room, and then when the physician gets ready to examine you, you're going to push my little iPad button and the seat's going to roll back. If I have my way, it's going to be some nice mellow music going on, but so it's going to all be about the whole experience.
Foot massage?
Yeah, we might.
Okay, cool. Thank you.
So if you've got just under 200,000 employees, where do you look to spend your time in a very complex organization? Physicians taking care of patients, you've got to run the operations of a hospital, you're looking at new technology, which is shiny and fun. Where do you as the CEO look to spend your time, and how do you pass that on through the culture of such a large organization?
Yeah, that's a great question. I probably spend...
Why are all his questions the great questions?
Yeah, good question.
Okay, all right, okay.
Max fed them to me.
So some of it has to do with your view of what a CEO should be doing. And, I view my job as thinking about the future. I think that I would under-leverage my platform and my role if I was knee-deep into today and the operations of today. So I have smart executives, I have smart people who work with me, and I do not micromanage. I micro-monitor, but I don't micromanage.
What does that mean?
Micro-monitor means that at any point when I need to know the details, I get the details. And then the details allow me to go deep when I need to go deep. And then I look for trends and I look for patterns, and then I test whether or not those are anomalies or in fact represent a problem. So if you're a member and you write me, I take that very seriously. And if I get two that says pretty much the same thing, I go into a deep dive. Say, you know what, I got these two, help me understand it. And I've built a culture where everyone understands this is about being on the same team. This is not a got you. And so that's work that we have going on. A big part of my job is outside of the organization. So I spend a significant amount of time gathering intelligence around the country and in fact, around the world. How are people thinking? What are the customers talking about? What my major purchasers want from me? How's the government behaving? What's on the horizon? And then how do we think about inside of Kaiser Permanente 5 to 10 years from now, which is our vision. Our vision in Kaiser Permanente, the way I frame it, I try to bring clarity to the long-term view of the organization to deal with, if you will, our intentionality. I don't try to create the vision to say, I got this blue sky, it's we are the world of the future. It is to say, with everything that I have today in terms of the assets, with where I think we need to be 10 years from now, what are we going to consciously drive towards in terms of defining our future? And clearly, care anywhere is a part of our future. That we are going to figure out how to turn the home into an incredible place where future care is being provided, right? And we're going to figure out how to get people as turned on about the specifics of their body as they are about an automobile. And so the wearables and the sensors that are now just flooding the market, we see a great use of that over time. And so in our future, someone will be as interested of how sugar burns to energy as you are gasoline running a car, right? And what happens to the body if you're not sleeping 6 to 8 hours a day? And then how do you retool yourself in those situations? In our future, Kaiser Permanente wants to have a bigger impact on you when you go into grocery stores than because what you eat is a precursor to what's going to happen. And so in our model,
like a digital life coach.
Yeah, yeah.
Thank you.
And so in our model, some of that stuff.
Thank you for not saying no.
I caught that. I caught that. And so that's part of my job. And then the other part of my job is to continuously be a cheerleader inside the organization.
What? Couple just quick questions. So what do you guys? How do you think about data, patient data? That as an asset, what you can do with it in terms of new products. Do you think about that, or do you think about the transaction, like the telemedicine transaction, or the ultimate underlying data that you're generating, and what can be created or optimized because of that data?
Oh, the data is incredibly important.
Is that a good question?
Yeah, it's a good. It's a great question.
Thank you.
Great question. Eventually, in our lifetime, we are going to get to precision medicine. We happen to be, I call it fingerprint medicine, right? It's where each person's fingerprint, the uniqueness of you, will be much better understood in how you access care and services in the future. I think that is as real as I am talking to you. It's a matter of time. The fact that we are right now dealing with the beauty of a medication that can cure something called hepatitis C, can cure hepatitis C, is just a precursor of where we're going with technology, biotechnology, with genomics. All that is coming together in the 21st century. That's really built around the ability of technology that's allowing us to think very differently, behave very differently. In old medicine and new medicine, in old medicine, there were clinical trials and there were random samples and there were assumptions made based on that about how that would affect a big population. And then depending on, I mean, you gave a great example of it. Here's a statin, you give it to this person, it seemed to be fine. You give it to this person, and you have all these problems, you go, oh, it doesn't work for this person. In the future, we're going to have the ability to be much more precise about how individuals are reacting to certain things. That comes with the data. The other reason the data is important inside of Kaiser Permanente is because we're driving the industry to understand both individual care and population health. Mm-hmm. And so the data for us is critically important because you start to pick up patterns about the holistic approach of individuals. Where they live impacts health. And our ability to understand that is critically important. Mm-hmm. And now we're able to aggregate data in a way that we can study it very differently from the rest of the industry. So I know of my 10.5 million members, how many have diabetes. And that information is studied to look at best outcomes based on a variety of treatments that are provided to this population. Is
there anything in your way in terms of collecting that data, storing that data, doing things with that data, or is that, from a regulatory standpoint, is that not a blocker?
It's a challenge. Okay. We have actually taken the approach to embrace the regulatory environment. One, we don't have a choice. And then secondly is because we are ahead of the regulation. And so in many
Right.
cases, we're doing things to meet regulatory requirements that have absolutely no use in my system because I've put the technology in place to do what the regulation is now asking me to do.
Right.
And so we're working with them to understand it. We work with them about the e-visits and why it was important to help us to deal with the HIPAA requirements while also giving the access and for the physician and the members to have that kind of virtual interaction. And that's how we got to secure e-visits.
Got it. And then last question officially is who are you most worried about? Maybe not a company, but a trend. And what, who do you think loses the most in this sort of new era of healthcare from an industry or category standpoint? You can. Yeah.
I'm like Donald Trump. I don't worry. No, no. I don't look at it that way. I'm more worried about the other point that you made, which is, are we going fast enough? Mm-hmm. So I'm more worried about, as I call it, the BPMs at Kaiser Permanente, the beat per minute. Do I have it above 100? And are we executing correctly? So I worry about that a lot. In terms of the ones who are challenged right now, it's more of the solo, for example, hospitals who are reading the tea leaves and they're very concerned about the future because they don't have the resources at the level that, for example, we have at Kaiser Permanente.
Right. Awesome. Bernard Tyson, thank you so much.
Thank you.
Appreciate it. Thank you.